Hey, everybody.
Welcome back to Medical Monday.
Welcome back.
So we're going to be talking about a topic very near and dear to heart. It's diabetic neuropathy, one of the conditions we specialize here in the office with, and that Dr. Gabby is board certified with treatment. And why are we going to be talking about this? Because 100 different types of neuropathy, according to Johns Hopkins, the number one type is diabetic neuropathy. And it affects, about 25 to 30% of all Americans have some form of neuropathy. And it costs us, according to the CDC, $100 million a year just in treatment.
Yes. Everything you just stated is 100% true. And it's all very, very preventable as well as manageable. So that's what we're going to talk about this week. But before we get started, I do want to ask everybody to like and share, subscribe. We are so excited to be here. And part of our request is because so many people like it and love what we're sharing that we would really hope and love for you guys to share that for us as well.
And if there's 25 to 30% of Americans that have neuropathy, if you're watching this video, chances are a friend, a family member, a loved one has it, and with you liking and share it, it may find its way to them so they can get this good information.
Yes, absolutely. So without further ado, diabetic neuropathy, and some of you might be asking, well, what exactly is diabetes? What is diabetes? Well, diabetes is a condition that is a hormonal problem that's caused by the pancreas. We're not going to get into much detail there, but what happens is the pancreas is not sure, do I do too much insulin or what do I do here? What do I do? More hormones, less hormones? I'm so excited.
It's a trigger system. Your body tells the pancreas, hey, we've got sugar and the cells need it, so produce insulin so it can get into the cells.
And break it down.
But the thing is your poor pancreas is tired. It doesn't want to do it. It has an overload because we eat too much sugar. So your pancreas gets very, very tired and then does not perform. It does not release the hormones it needs.
Yes, and so that's whenever it doesn't know if it needs to do more or less. There's a lot of arrows, there's a lot of proteins and enzymes listed here, and when we get diabetes, it's because our body can actually no longer naturally and efficiently do it itself. It needs help. It needs hormone replacement. It needs assistance there. So that is where diabetes comes from.
But diabetes affects some very important things, and that's why it's very specific with neuropathy, because diabetes really affects your very small blood vessels.
Yes, so your number one reason or cause of neuropathy is diabetic-induced neuropathy. What we are here to talk about is that specifically. So there are different types of peripheral neuropathy. Peripheral means periphery, or
hands
our
and
hands
toes.
And our toes and feet away from the body. And so peripheral neuropathy affects those, diabetic neuropathy being the most common. And what it is it's actually deadening or dying of the blood vessels, which causes damage to the myelin sheath of the nerve. That's the protective or the covering of the nerve. And so over time, more and more damage happens, and this ends in amputation, which we don't want to happen.
No. And it's very important when we look at that slide to know it's about the blood vessels. So when you're treating neuropathy, we should always look from a scientific mind as far as, well, what are we treating?
Yes.
We treat the cause. Like, what's causing the problem? And that's always very, very important to think about. And we'll talk about that a little bit later as Dr. Gabby finishes up some of what the nerve actually is.
Yes. So, and you hit on the blood vessels. You can see that in here. There's blood vessels in this image to show that when we have bundles of nerves, think about a highway system. The bigger highways have lots of traffic, and then as you veer off, there's less and less flow of traffic because there's fewer lanes and less people need to go there at that time. So our blood flows very similarly. And what we're talking about when we talk about peripheral neuropathy are the very small blood vessels and nerves in our fingers that allow us to feel different sensations and feel if we're on carpet or tile, if we're tripping, things like that. So
they're so small that they're the first ones that get affected, and those are why the first thing that gets amputated are fingers and toes.
Yep. Because they are the first. They have the smallest blood vessels. They have the smallest nerves. So it's very important to support all of that when we talk about peripheral neuropathy, because those are the things that are being affected most.
Yep. So we want to get to the root cause, and that's what we want to treat.
Yes.
So you at home, if you have diabetic neuropathy or diabetic that's worried about getting neuropathy, what are some of the things that you do?
Yeah. Believe it or not, just eat this and not that. Lifestyle modification, lower inflammatory eating. So if you're big on carbs, pizza, boxed foods like pastas, macaronis, those are not good.
Those are what creates that giant spike of insulin that eventually over time will wear out your pancreas, and that's when we talk about it just gets sluggish. A lot of the medications that we give are to help speed it up, but is just so tired that eventually those don't work either.
Yes, absolutely. And he talked about the spike. A huge part of helping to control diabetic neuropathy, but also your diabetes, is to monitor your blood sugars. So very important, because when you realize what you eat or how much you're eating causes those spikes, you're able to control and manage that blood sugar significantly more efficiently and on a significantly healthier, more moderate style there.
Yep.
Yep.
But say you are having issues with it and you want to seek professional help. We all go to an urgent care, or we go call our primary, or whoever's dealing with us. And what's the first thing they're going to tell you?
Yeah, they're going to talk about lifestyle.
Yeah.
All right. So what they're going to do is set you up with a dietitian or a nutritionist in different aspects, and they're going to start working on lifestyle, activity level, eating habits. I mean, there's just a slew of things that you can just break down into those different aspects, but it's important to move. It's important to eat clean and truthfully support your body.
And this is where it comes into that fine line. You know, we always talk about every week, well, what are things that you can do at home? But it gets confusing. You get on Google and there's, 100,000 different fad diets, or eat this, don't eat that. So, if it's overwhelming for you, don't feel as though you're alone. Seek professional help, and that's what they can do, is get you in contact with an actual professional,
Yes.
a registered dietitian, something that can help you, weed through the Google ins and outs.
Yes, very true. Do not get overwhelmed. There's tons of resources out there to help with where you are specifically. The next step, really, depending on what's going on, is to manage the diabetes. We have a lot of people that are pre-diabetic. We have a lot of people that are full-blown diabetes that are not on insulin. There's a lot of different aspects in regards to how to treat it specifically when we talk about diabetes. But there's prescriptions, there's glucose monitoring, specifically different types, and so there's lots out there to help manage the diabetes when it gets out of control and you can no longer do it on your own.
And that's the hard part. That's part of discussion with the patient, what's going on. When a patient gets to a point of even just normal medication for diabetes, it's not something that we want to put patients on. But then when we end up progress to more and more types and subcategories, and then progress into insulin, it's very frustrating, because there's plenty of resources out there, and there's other assistance that you can have that'll help you with your diet or exercise. And I don't really want to use the term diet. It's really a lifestyle. It's just taking control and doing the right thing to try and help your health and be the healthiest you can be.
Yes, that's very true, and that's what it's about. And then, in a lot of instances, what we see here for our neuropathy patients, diabetic specific, is they end up getting on prescriptions that help block the communication between the nerves and the pain receptors and the brain. It actually affects cognition in a lot of instances, so they're not the most popular of prescriptions to be on, but we have a lot of patients that their number one goal is to just reduce the amount of prescriptions they take to help reduce their pain to get through the day. Yeah. So it's not just always a function.
That's a sad slippery slope, when we talk about diabetes that causes neuropathy, is that oftentimes they're depressed. They're not eating well, they're not feeling well, they're continually gaining weight, they feel as though they just can't get it under control. So that's one of the first medications, is an antidepressant, and then from there there's a couple other ones that, like Dr. Gabby was talking about, kind of block the signal that the nerve's sending. The nerve's sending the signal, hey, I'm not getting enough blood supply. You feel this burning, tingling sensation in your feet for a reason. Now, you block that signal, doesn't mean that the signal stopped, it just means that you're not receiving it anymore.
Yeah. It's exactly what happens, is that the damage is still occurring. It's still there. It's just you're not experiencing it as you should if you weren't on the prescription.
But there's a couple of other things. Like say you wanted to try some of the great neuropathy treatments that we have here. What are they specifically? Since you're board certified to treat neuropathy, what are some of the great things that you're going to bring to a patient if they came through the door?
Thank you. Rub it in a little bit more.
I'm just letting you know.
So yes, we have home therapies. There are 2 home therapies specifically, a light therapy as well as an electrical therapy to help stimulate those nerves. It's very important to continue to utilize those nerves and stimulate them. So electrical therapy is very important. And then the other aspect is light therapy. Light therapy is a phenomenal tool that's utilized. There's tons of research out there for both of these items. And so they're used to help increase blood flow with nitric oxide production. So that's very important. We talked about blood flow numerous times, and so blood flow is a very important aspect of neuropathy care and treating it, correcting it, not masking it.
And Dr. Gabby talked about a couple of specifics, whether it's light therapy or electrical therapy. Once again, the Google can get you in trouble looking for certain things. I know that specifically to the lights, there's two different types of bulbs that are oftentimes utilized, and why do we use the one that we have?
We use the one that we have because that's where truthfully the research is at and where the best results come from.
Correct.
We only utilize the equipment that is specifically designed, backed with science, backed with research, and constantly under, how can we make this better? How can we make this better? So it's all about making sure it stays state of the art on top of where it needs to be.
And I do know that it's a placement too of where they're made. There's a very cheaper version that you can find in China, and then there's of course another version that's studied, researched, has great results, and that's why we utilize it here.
Yes, and it is not made there.
It's not made in China, so
Not
we
made
don't
in
have a whole lot of shipping issues with it right now, but
we do not.
we work on it.
Yes, and then believe it or not, we're going to talk about this again. Lifestyle.
Yes. It's very important. It's the
very
key.
important.
It's the keystone to everything. It's not,
It is.
Today's topic is diabetic neuropathy, but it's the keystone to everything.
Everything that we talk about, lifestyle. Especially when you talk about diabetic neuropathy, so much of it is caused by a history of not so great lifestyle choices. And so at what point do we change those lifestyle choices? And that's what we're here to do, is support you through that, teach you farther past what Google can offer, and allow to calm down a lot of that, like, where do I start? Well, you eat the elephant one bite at a time.
There you go.
All right? And so we're going to work on that lifestyle process one bite at a time as well.
Yep.
So lots of lifestyle.
Great lifestyle things, but then we also have a couple of injections, some regenerative injections to help that nerve function, a couple of choke points as it passes through. We want to take care of those so that the nerve signal travels unimpeded and can get to the brain and give a proper signal.
Yep. So those regenerative injections. And then that is our Medical Monday on diabetic neuropathy.
That's it.
Again, I want to ask, if you know anybody that has diabetes, if you know anybody that has diabetic neuropathy, please share, comment, tag them on this post so that they can, get the information they need to make the results that they can.
And I hope you got all the information you needed. We enjoyed doing Medical Monday. That's it for this week. We will see you next week for Medical Monday.
I'll see you next week.